Welcome back. Throughout the pandemic, unfortunately, loneliness was a problem for many individuals and highlighted those people who are already feeling lonely. It just made it that much worse. Well, it's definitely an issue, especially among adults 45 years old and beyond that. And what is something that we can do to help solve that? Well, our furry friends are part of the solution. Let's take a look and learn more about this topic right now.
Months of social distancing during this pandemic has left many of us feeling a bit lonely. It's taken an emotional toll on people of all ages, and a new study is taking a closer look at how therapy dogs can help, especially for older Americans who are experiencing loneliness. Here with a closer look at the power of the human-animal bond and the role our four-legged friends can play in easing loneliness is Dr. Angela Hughes, who is a veterinarian from Mars Pet Care, and Dr. Nancy G., Director of the Center for Human-Animal Interaction at Virginia Commonwealth University. Thank you, both of you, for being here today.
Thank you so much for having us.
Thank you.
Angela, how has the pandemic shed light on the problem of loneliness?
So even prior to the pandemic, loneliness was at epidemic levels. In fact, experts have equated it to roughly smoking 15 cigarettes a day in terms of its impact on our health. So it's quite serious. But the pandemic itself has exacerbated that further. And now 6 in 10 adults report feeling lonely since the start of the pandemic. And older adults in particular are impacted because of the high rates of infection and mortality. They've had to be extra careful and isolate themselves further from largely society.
Dr. G., how are older Americans vulnerable to loneliness, and what is the health impact?
So even outside the pandemic conditions, adults who are 60 years and older, 43% of them report feeling lonely. The pandemic obviously exacerbated that, as Angela points out, but a situation that's even worse is when older adults are hospitalized. When they go into the hospital for some kind of treatment, they're displaced from their social networks. The time that they're awake, they're actually typically physically inactive and socially isolated. 75% of them report feeling lonely. And loneliness itself is associated with a number of adverse mental and physical health outcomes, like an increased risk of depression and cardiovascular disease. We also find that people who are lonely are less willing to invest in their own rehabilitation process. So it's possible that loneliness actually negatively impacts recovery for those patients.
Angela, owning a pet comes with a lot of responsibilities, but are there other ways where people can spend time with animals to help alleviate their loneliness?
Yeah, so in many cases, companion animals can really be a nice replacement, at least on the short-term basis, for interactions with other people when we can't be close together. And in fact, evidence is mounting that shows that animal therapy programs, such as the Dogs on Call team at VCU Health that Nancy leads, can really positively impact people's mental health and even the physical health as well. Studies of patients going in for a major procedure who spent time with a therapy dog prior showed less fear and anxiety. And our healthcare workers, who are, stressed extremely right now and doing heroic stuff, spending 5 minutes with a therapy dog showed significant reductions in their cortisol levels, a stress hormone. So we have seen this across the board in helping people in all sorts of different circumstances. And so even if you can't have a pet in your own home, because it is a major responsibility, there may be other avenues that we can explore to provide this type of benefit to people.
Well, in only 5 minutes with a therapy animal, that's impressive. Dr. G, can you tell us more about the new study and how it will explore the effectiveness of interacting with a therapy dog to improve loneliness?
Absolutely. So loneliness is our primary outcome measure, but we're also going to measure a number of other things, including depression and anxiety and pet ownership history and a variety of variables. And what we're going to do is we're going to look at older adults who have been hospitalized for some other reason, and then we're going to bring our Dogs on Call teams in to visit with them. So they'll get a visit on each of 3 consecutive days that they're in the hospital. We'll measure them before and after each visit, and then we'll measure them 1 month and 6 months later. So what that will do is that will provide us information that allows us to get some, not only information on their hospital stay, but their post-discharge care and also their recovery. So the study itself is a randomized clinical trial with a longitudinal follow-up. Essentially, it's sort of the gold standard for this kind of research that will really help us to answer these critical questions about the degree to which therapy dogs may alter trajectories of change or alter their care in the hospital.
And Dr. G, given this study involves humans and animals, how will you be monitoring them both for their well-being during the study?
Yeah, it's a great question. So the humans obviously have their entire healthcare team monitoring them, but some of those measures are going to be included in the study. So we'll be tracking those a variety of well-being measures for the humans. But importantly for this study, we're really going to be looking closely at the welfare and the well-being of the dogs involved. So each dog will be outfitted with the Whistle Fit Tracker, which is a tracking device that fits on their collar, and it monitors. It's a smart device that monitors health and fitness 24 hours a day. So we'll be able to look at how they're sort of interacting in the hospital and also compared to their behaviors outside of the hospital so that we can see the degree to which they're stressed and how their well-being is affected. And also, we're going to have lots of great communication with their handlers to make sure their handlers are assessing their well-being throughout the study as well.
Angela, once we know the results of this study, what do you hope will change?
So, as a result of this pilot study, we're hoping to get a better understanding of what circumstances allow pets to help human health. And can we provide evidence-based recommendations to professionals that are working with people who are impacted by social isolation and loneliness to help them understand when it's best to recommend an animal, either in the home or through an interaction program such as the Dogs on Call team, to help them as one of the means to work on their mental health issues. So if folks are interested, they can go to waltham.com, so WALTHAM.com, to learn more about this study and other related studies that we've done in the past.
Well, thank you so much, Dr. Angela Hughes and Dr. Nancy G, for joining us today, for helping us understand loneliness and this pet therapy study. We appreciate your time.
Thank you so much for having us.
Thank you.